With more than 86% of Australians now fully vaxxed, that is a huge achievement. Today, a national campaign will kick off, encouraging Aussies to get their booster shot.
Joining us now from Canberra is Lieutenant General John Fruin, who heads our vaccination task force. Busy man. Thanks for your time again. Appreciate it. How many Aussies have received their third jab so far, and how many more are eligible?
Yeah, so right now, Carl, there's about a bit over 500,000 Australians who are eligible for their booster shot, and we've seen people coming forward in great numbers. We've had more than about 370,000 people already step forward, and of course the early people who are coming due are many of either the most vulnerable or frontline health workers and the like. The big numbers will come due in the new year.
What are your thoughts on these calls to change the definition of fully vaccinated to include having the third dose?
Yeah, look, at the moment that's not going to be the requirement, Ellie, so I'm sure ATAGI and the medical authorities will look at those sorts of things, but right now it's very clear, the guidance, that your first and second dose is what's most important, and the booster, as the name says, really just tops you up to that maximum possible protection.
Lieutenant General, can we just say this? You have done an outstanding job. I mean, this country, the mind boggles at how well the country's done. But you yourself in spearheading this has been outstanding. Is there a concern, or do you harbour any concerns that there may be complacency with the booster shot?
Yeah, look, the sentiments we're seeing at the moment is there will be very strong uptake in boosters. I mean, it's been amazing how people have stepped forward across Australia to get to these fantastic numbers. And I think so people understand just how important these vaccines are for not only their own safety but for the safety of their friends and families. And boosters, they're available. The supply issues that we faced in the early days of the rollout don't exist now, so it's going to be very easy, very convenient to get a booster. So again, I'd really strongly encourage anyone that when they fall due to do so.
Carl just mentioned there that hesitancy with the booster shot. I mean, you've still got people who are hesitant about getting the shot at all. And if you look at Queensland, and there are fears that they might not hit that 90%, how do you help get the state over the line?
Yeah, so look, it's fantastic. We've got ACT, New South Wales and Victoria are over 90% fully vaccinated now, and that's a fabulous number. But all of the other states and territories are up in the mid-80 percentile now and heading up towards 90 in their first doses. And of course, first doses are usually the best indicator of the sort of place we'll get to. So people are coming forward, but we're still working really closely with all of the states and territories to make sure that people have got the right information, have got easy access to the right information, and we're working with community leaders and influencers and the like just to help people understand the individual and collective importance of this. And the numbers indicate that the absolute vast majority of Australians see the importance of this.
I think there is a little bit of a feeling in Queensland, not just because I come from there, but I have family and friends who live up there. When Anastasia the other day said COVID for Christmas, it was, it was whatever, but I think there is still that feeling up there to keep it out as long as possible, and they'd be happy with the borders shut for as long as possible.
Yeah, look, that would be fantastic if it is possible, but I think we've seen with Delta that Delta will find a path, and the path it finds is through the most vulnerable, and the most vulnerable are the unvaccinated. Now that particularly New South Wales and Victoria are opening up and international travel will start to open up, Delta is going to move, and we've seen it starting to get to communities where it hasn't been before. So, the message that we just keep imploring people is get prepared now. It's, now's the time, not after you get an outbreak in your communities. And we see where there are outbreaks that people, if they haven't already got vaccinated, they move very quickly to get vaccinated. But it makes much more sense to do it before then.
That's it, isn't it? Your job's not yet over with this one, is it? I also wanted to get your thoughts of us sending our troops and forces to the Solomon Islands. It's a big job, isn't it, helping to restore peace?
Yeah, look, Solomon is a magnificent country. I spent time there in similar sort of circumstances, but I just wish everybody involved in the mission all the best. I'm sure they'll help bring things around quickly there, and send all my best to the people of the Solomons as well.
Are you looking forward to getting back to your day job?
Do you remember what that was?
I'm firmly focused on getting this finished, and that's what we'll do.
Where is the finishing line?
We'll get the vaccinations done. We'll make sure that the booster program is absolutely well in place. We've got one eye on 5 to 11s potentially in the new year as well. So there's still lots of work to be done, but the first half of next year we'll get to a point where we think that's all in good order and someone will send me back.
To your happy place. Lieutenant General, thank you so much for your time again. I know
your efforts this year.
It's just incredible. It's incredible what this country has done. Thank you for leading it. Appreciate it.